It is great to know that we have people streaming in from all over. Welcome to everyone online. This isn't just a Manitoba issue that we're here to discuss. It's not even just a Canada issue. It is a global one. And we are happy to have people from all over tune in. But before we begin, I would like to acknowledge that the Winnipeg Humane Society is on Treaty Number 1 territory, the traditional territory of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and the homeland of the Red River Métis. We acknowledge that Winnipeg's water is sourced from Shoal Lake 40 First Nation, and Winnipeg Humane Society respects its partnerships with Indigenous communities and works together through collaboration and reconciliation to support animal, human, and environment. So just briefly, by way of background, the Winnipeg Humane Society is 131 years old, and most people associate us with companion animals. But actually, we got our start advocating for the welfare of farm animals. Our animal advocacy has long been a critical piece of our mission, whether they live in our homes, the wild, or on farms. The WHS is dedicated to protecting animals from suffering and promoting their welfare and dignity. The pressing issue of antibiotic resistance also has roots in animal welfare, which you'll hear more about this evening from this incredibly knowledgeable panel that we're so fortunate to have join us. And as an anecdote, I can share with you that on a real life experience on the ground, just a couple of weeks ago, one of our own team developed an infection that required them to go to the hospital, and they had to have antibiotic trials until they found one that works. So the time for discussion really is now. So before I hand you over to our moderator for the evening, I would like to acknowledge and thank Vicki Burns and John Lawson for supporting tonight's event. This is an issue that is very close to Vicki's heart. She's very passionate and knowledgeable about, and we've been so grateful to have her guidance as part of our planning committee. Thank you both. Tonight's moderator is also a passionate animal advocate who uses her talents to increase the welfare of all animals. Jessica Scott-Reid is a Winnipeg-based journalist, and for the last decade, she has written about factory farming for publications including the Winnipeg Free Press, the Toronto Star, and the Globe and Mail. She's also the culture and disinformation correspondent for Ascension Media. Welcome, Jess. Thank you.
Thank you, Christina. Welcome everyone to Farm Fork Pharma. My name is Jessica Scott-Reid. I am a local journalist here in Winnipeg. I'm also a proud member of the Winnipeg Humane Society's Animal Protection Committee. And today I'm excited to be your moderator for this important information session about antibiotic resistance, factory farming, and how this connection impacts animals and us. So just a quick note that during this presentation, you will hear different terminology being used: antibiotic resistance, antimicrobial resistance, also the acronym AMR. So for the sake of this event, these terms may be used interchangeably, but to very, very simply clarify, this will be clarified better throughout the night. While an antibiotic is a type of antimicrobial that specifically targets and kills or inhibits bacteria, antimicrobial is a broader term for any agent that kills or inhibits a wider range of microorganisms, including viruses, fungi, parasites, and bacteria. And so all antibiotics are antimicrobials, but not all antimicrobials are antibiotics. So this will become a little bit better illuminated throughout the evening. So for a quick rundown of how tonight's events are going to go, we'll have two 25-minute presentations by our speakers here, followed by a panel discussion where I'll be posing some questions. If any of you have any pressing questions, we encourage you to do so afterwards during the reception up in the lobby. You can speak with our presenters then. So first, to begin, our first speaker comes from the UK. He is world renowned for his work Colleen Noonan is the Policy and Science Manager of the Alliance to Save Our Antibiotics, an alliance of 71 member organizations co-founded by Compassionate World Farming, the Soil Association, and Sustain to campaign against the overuse of antibiotics in livestock farming. He has co-authored numerous reports on antibiotic resistance and antibiotic residues that highlight the human health impact of excessive antibiotic use in intensive livestock farming. The Alliance's work aims to encourage a move to more responsible use of antibiotics in farming through better regulation, voluntary actions, and improvements in production systems, which will also improve animal health and welfare. And if you haven't seen his TED Talk on YouTube, I highly encourage you to go ahead and watch that after this presentation. Welcome, Hoyland.
Thank you very much for that introduction. I'm here to speak about why we need to reduce the use of antibiotics in livestock farming in order to help us tackle the antibiotic resistance crisis and how we should go about doing this. So first, we need to define some terms. So an antibiotic is essentially a medicine that is used to treat bacterial infections in either humans or in animals. And antibiotic resistance is this ability that bacteria have to adapt to the actions of antibiotics so that they are no longer harmed by the antibiotic. So what happens is that the bacteria cause an infection and then the antibiotics are given, but some of the bacteria have a genetic mutation which enables them to resist the antibiotic, and so these bacteria survive and then they ultimately can go on to multiply. And so what happens is that the more we use antibiotics, particularly when it's done routinely, the more we tend to end up with antibiotic resistance. Now, we've known about antibiotic resistance since the beginning, since we first began to use antibiotics in human medicine in the 1940s. So why are we so concerned about it these days? What has changed? And so what's changed is that in the early years of the antibiotic era, scientists were discovering many new types of antibiotics. Between the 1940s and the 1980s, they discovered 22 different families of antibiotics. So if resistance developed to one of the families, you could always use another antibiotic. But for several decades now, we've been in a discovery void. Now, new antibiotics are coming onto the market for use in human medicine, but they are generally related to existing antibiotics, or they are antibiotics that were discovered decades ago, and so antibiotic resistance already exists to them. So the consequence of antibiotic use can be quite severe. Many experts call it a silent pandemic. And the reason they call it a silent pandemic is because the impact globally is really very large indeed, and yet most people don't realize the extent of it. So the best estimates we have are that antibiotic resistance is directly responsible for the deaths of 1.1 million people a year, and it is associated with the deaths of 4.71 million a year. And the forecasts are that if we fail to take sufficient action, that in the next 25 years, so by 2050, antibiotic resistance will be responsible for 1.91 million deaths a year, and it will be associated with 8.22 million deaths a year. Now, antibiotics are not just used to treat humans that have already got a bacterial infection. They are also very important preventative medicines. For instance, when somebody is undergoing surgery or cancer chemotherapy, and the patient is more at risk of developing a bacterial infection. So the antibiotics are used preventatively. But the more we have antibiotic resistance, the more this threatens to undermine these and other procedures. And this is why the World Health Organization is saying that the rise of antibiotic resistance threatens many of the gains of modern medicine. So antibiotics, so I've said that the more we use antibiotics, the more we tend to end up with antibiotic resistance. So it's really quite striking to realize that globally, about 2/3 of all antibiotics are used in farm animals and not in humans. And a very large majority of this farm use of antibiotics is for the treatment of groups of animals. So the antibiotics are added to animal feed or to drinking water to treat groups of animals. And only a small proportion worldwide is used to treat individual sick animals. So it's very different how antibiotics are used in human medicine. And the reason that group treatments of antibiotics are so common is that the antibiotics are essentially being used to prevent or to control the infections caused by the intensive conditions in which many of the farm animals are kept. So, whereas in human medicine, the introduction of antibiotics has had huge benefits globally for human health, the introduction of antibiotics into farming has actually led to the animals being kept in unhealthier and more stressful conditions. Ultimately, it hasn't been very good for their health. Now, antibiotics can also be used as growth-promoting agents. In some countries, it used to be worldwide, this use, but it still exists in at least 36 countries worldwide. Now, the rise of antibiotic resistance may also have a significant impact on livestock production. So the World Organization for Animal Health has estimated that by 2050, antibiotic resistance could cause a global economic impact on livestock production of between $575 billion and $953 billion. In addition, according to their forecast, it may have an impact on livestock production by an amount equal to what it calls the consumption needs of 746 million people, up to 2 billion people by 2050. So, what is the link between how can antibiotic use in farm animals have an impact on human health? Well, there are various ways that this can happen. So one of the major ways is through the food chain. Now, what happens is that the animals are fed the antibiotics. These antibiotics go into their guts where they can essentially select for antibiotic resistance. So they end up with antibiotic resistant bacteria in their guts. When they go for slaughter, some of these bacteria ultimately end up contaminating the carcass and end up on meat. And then when a consumer handles raw meat or eats undercooked meat, these bacteria can be transmitted to the consumer and ultimately contribute to antibiotic resistance infections. So it's primarily the resistant bacteria that are the risk. There are also residues that can occur in the foodstuffs, but these are generally considered by most scientists to not contribute as much to antibiotic resistance, passing on the resistant bacteria. There can also be transmission through the environment. So, for instance, when the animals are fed the antibiotics, up to 80% of the antibiotic will actually go right through the animal and end up in the manure, but also there will be resistant bacteria. So when the manure or the slurry is spread on land, it can end up contaminating crops or waterways, and this can ultimately make its way to humans. And then there is also the potential for direct contact between the animals and humans, and this can lead to bacteria transmission. So farmers themselves are in fact at higher risk than most members of the general public from this kind of transmission. So, so to what extent, or can we say that farm use of antibiotics is contributing to resistance in human medicine? But it is important to note that scientists generally believe that human use of antibiotics is the main cause of antibiotic resistance in human infections. However, there is very clear evidence that the farm use of antibiotics does contribute to resistance in human infections. A review established by the UK government found that a large majority of the scientific literature agrees with this position. So examples of bacterial infections where this happens include Salmonella, Campylobacter, MRSA, Clostridium difficile, and Enterococci, and there can be others as well. So MRSA and Clostridium difficile, for instance, are very frequently or have very frequently been referred to as hospital superbugs because they tend to occur much more frequently in hospitals where antibiotic use is high. However, over the last 15 to 20 years, we have seen specific new strains of MRSA and Clostridium difficile emerging first in farm animals and then spreading to humans and causing infections in humans, including deaths. And we know that these infections, they are called livestock associated, do come from farm animals. And scientists have provided evidence that the use of specific antibiotics in farming are ultimately the reason for the emergence and spread of these new strains. Now, another example which made headlines around the world when it happened was the emergence of resistance to an antibiotic called colistin, which is a last resort antibiotic used in human medicine. Now, resistance to this antibiotic had never been found until Chinese scientists found it in 2015 in pigs, in poultry, in retail meat, and in human infections. And we know for sure that this was due to the farm use of the antibiotics because at the time, colistin was an antibiotic that hadn't yet been licensed in humans, but it was being used as a growth promoter in China. And colistin resistance has since been found in humans and livestock in many countries around the world. And despite this, colistin continues to be used in livestock in quite a few countries, although some have banned it. So what is happening? Are we taking action on this? Well, some things are happening, yes, in some countries, and there are even a lot of discussions at a global level. So last year was the second ever high-level declaration on antimicrobial resistance at the UN General Assembly, where they set out the actions that should be taken in both human medicine and in veterinary medicine to reduce antibiotic use or make it more responsible in order to tackle antibiotic resistance. But unfortunately, in my view, in the actions that are proposed in farming ultimately ended up being very weak. So what there is included in the high-level declaration, a commitment to end the use of antibiotics for growth promotion in livestock globally, but no deadline for this was set. Proposals from the European Union and the United Kingdom to phase out growth promotion by 2028 and to phase out routine preventative use of antibiotics by 2030 were ultimately rejected and not included in the declaration. An expected target of 30% reduction in farm antibiotic use by 2030, which had been supported by dozens of countries, was ultimately not included in the declaration. And it has been reported that the governments of the United States, Canada, Australia and New Zealand were partly behind weakening the actions on farm antibiotic use, as were organisations representing the veterinary pharmaceutical industry, and some intensive farming industries. Now, fortunately, there are actions in various countries around the world, and in particular in the European Union, there has been some quite strong action in recent years. So in 2022, new rules came into force in the European Union. So the European Union had already banned growth promotion in 2006, but now all forms of routine antibiotic use are in theory banned. Furthermore, using antibiotics for preventative group treatments has been banned in the European Union. Group treatments are still permitted, but only under certain circumstances, and there needs to be clear evidence that some of the animals in the group at least are sick. You may not treat a healthy group of animals with antibiotics anymore in the European Union. There's in my view, very important new rule which says that you may not use antibiotics to compensate for poor hygiene, inadequate animal husbandry, or poor farm management. And I will come back to this later on in the presentation. The importation of food produced with antibiotic growth promoters will be banned in September of next year. And all EU member states are now required to collect antibiotic use data by farm animal species. Now, European governments and European farmers knew that these rules were coming for many years, well, probably about a decade, or rules similar to these. And so many countries have, so many countries have been taking action in their own countries in the build-up to the introduction of these new rules. And as a result, European farm antibiotic use has actually fallen by 51% since 2011. And the good news is that this reduction in European farm antibiotic use has led to falls in the levels of antibiotic resistance in those European countries that have taken action and have significantly reduced their use of antibiotics. So reducing antibiotic use can lead to reductions in levels of antibiotic resistance. However, if we look more closely at the data, we see that there are huge differences in the levels of farm antibiotic use in the European Union, even though nominally they are now all supposed to be applying fairly strict rules. So we have the lowest users, which are countries like Norway, Iceland, and Sweden, who use between 2 milligrams to up to 11 milligrams of antibiotic per livestock unit. And then at the other end of the scale, we've got some of the highest users, which are Spain, Italy, and Cyprus, which use up to 157 to 187 milligrams per livestock unit. By the way, Canada use is estimated to be around 150 milligrams per livestock unit. So Canada would be one of the highest users if it was on this graph. So on the right here, the columns show the level of use, and the orange line shows the percentage of the antibiotic use in that country, which is group treatments. Now, for the EU as a whole, 85% of European farm antibiotic use is still for group treatments, despite the ban on using antibiotics preventatively for group treatments. And this is ultimately a very disappointing result. But as you can see on the graph, a large majority of the countries, they have a very high percentage of group treatments, and the higher that percentage is, generally speaking, the higher their level of use is. And so the countries with the low use, countries like Norway, Iceland, Sweden, Finland, are actually, in those countries, most antibiotic use is actually for individual treatment. So in countries like Sweden and Norway, just 10 to 12% of antibiotic use is for group treatments. Overwhelmingly is for individual treatments. And this explains why these countries not only have very low antibiotic use for Europeans, but they are probably some of the lowest, if not the lowest, in the entire world. So one study published a few years ago asked this question: well, why is there such a big difference in farm antibiotic use in a country like Sweden and a country like Italy? And they said, well, their conclusion was that certain things had happened in Sweden that haven't yet happened in Italy. And they said that if these things don't happen in countries like Italy, then they forecast that the new EU legislation would not have the large impact that people had been hoping for. And so some of the key things that they highlighted that had happened in Sweden was that there became a widespread acceptance that change was needed. And this was not just from scientists or campaigners, it was from the farmers themselves, the people within the food industry who actually in Sweden took voluntary action even before the government made them take action. So they accepted that something had to change and they wanted to be viewed as healthy, as their produce has been healthy. So they took a voluntary action. They accepted that they needed to change. They also highlighted the need for the food and farming industry to invest in new production practices, particularly those that promote good animal health and minimize disease transmission so that you can minimize your need for antibiotics. They also said there needs to be fair pay for farmers, fair pay for the food that they produce, because without this, farmers would not have the confidence to invest and to change and to produce new practices. And so this is an important point too. They also highlighted the role that what they called outsiders had played in Sweden. And by outsiders, they meant people who are not directly involved in the food and farming industries. So that might be scientists, it might be campaigners, it might be journalists. And they said that the role that these outsiders had played by promoting the issue by the media had very much contributed ultimately to the farmers and to the government accepting that something needed to be done. So as one of these, of course, these practices can be these things can be done in other countries than just Sweden. And as one of these outsiders, I'd just like to give you an example of something that we've done in the UK. So what one of our campaigns has focused on supermarkets. And the reason we focused on supermarkets is that in the UK, many farmers sell their meat or their dairy products or their or milk rather, or their eggs directly to supermarkets. And so in 2016, what we did is we bought poultry meat samples from 7 leading supermarkets and we got them tested by scientists from Cambridge University, and they found that 25% of the poultry meat had highly antibiotic-resistant E. coli superbugs. And this made quite an impact in the national press in the UK. We then, on the back of this, wrote to the supermarkets saying that we thought they needed to develop antibiotic policies that they would publish on their website for their supply chain. And if they already had such a policy, we told them in what way they needed to improve it. So the following year, what we did is we published our first assessment of the antibiotic policies of UK supermarkets. We looked at 9 supermarkets for our first assessment. 8 of them by then had a published antibiotic policy, and 5 of those had a ban on using antibiotics routinely, which was one of our demands. But none of the supermarkets had published any data on antibiotic use in their supply chain. So this again got some quite good media coverage, and as a result of the supermarkets being criticised for refusing to publish any data, within just a few days, several supermarkets began publishing antibiotic use data on their website. So we have repeated these supermarket assessments several times. By 2021, we published our third supermarket report, and by then, all 10 of the supermarkets that we assessed had a policy banning routine antibiotic use in their supply chain. There was also progress on publishing antibiotic use data, as several supermarkets were now publishing this data on an annual basis. Most other aspects of their policies had also improved. And the strengthening of supermarket policies in the UK has definitely contributed to what has occurred in terms of antibiotic use, where there has now been a 59% reduction in farm antibiotic use in the UK since 2014. Now, I'd like to come back to this EU regulation because I do think it's particularly important. So it says that antimicrobial medicinal products shall not be applied routinely nor used to compensate for poor hygiene, inadequate animal husbandry, or lack of care, or to compensate for poor farm management. Now, on paper, this sounds really, really good and really important. And if applied correctly, it should really change how, not only how farmers use antibiotics, but ultimately it should change how we farm animals. And the problem, however, is that it does not seem to be applied in the sense that nothing has changed in terms of how animals are being farmed in most European countries yet. We know that if animals are farmed in different types of farming systems, and the way that they are treated and the husbandry, the production methods that are used have a big impact on the levels of antibiotic use. And yet, despite this rule saying you're not allowed to compensate for the fact that your production system is leading to bad animal health, you're not allowed to compensate with antibiotics, those production systems remain dominant. So just to give you an example of a production system where there is much lower antibiotic use. So one study that we commissioned of the antibiotic use of organic farmers in the UK that are certified by an organic organisation called the Soil Association found that the level of antibiotic use of organic farmers was about 4 times lower than that of conventional farmers, even though conventional farmers have now reduced their use by 59%. Various other studies of organic farming in other countries have also found very large reductions in the need for antibiotics. Also, studies from higher welfare indoor systems have significantly lower levels than standard intensive production, even though those levels remain significantly higher than in organic systems. Some free-range systems may also have lower levels of antibiotic use. Now, it's not really surprising that organically farmed animals in the UK have lower levels of antibiotic use, because in the UK, organically farmed animals need to be given access to the outdoors, obviously, when weather conditions permit. And in those sorts of conditions, animals don't tend to routinely develop disease or routinely need antibiotic use. But the reality is that in the UK and in most of Europe, most animals are farmed more in conditions like these, which essentially are indoor, constantly indoor, highly crowded and highly stressful, ultimately leading to disease and the need for antibiotics. So what are the specific husbandry practices? So I'd like to finish essentially by talking about some of the specific husbandry practices that are most associated with high or low levels of antibiotic use, and which ultimately need to be improved if we are going to ultimately implement in full the EU legislation. So First of all, animals when they are kept constantly indoors in highly crowded conditions, this leads to poor hygiene, poor air quality, higher levels of respiratory and intestinal disease, and higher need for antibiotics. So lowering the density in which we are keeping animals, also providing them for certain species, probably all species, but things like straw bedding for pigs. This also is associated with higher health, lower stress, and less need for antibiotics. When animals are given access to the outdoors, this meets their behavioral needs, and it can lower stress and have higher levels of health, as disease does not transmit nearly as easily in those sorts of conditions. So the period of a pig's life, which tends to be associated worldwide with the highest levels of antibiotic use, is around weaning time. So when pigs are weaned far too early, this is very stressful for them. They develop diarrhea, and this is frequently controlled with very high levels of antibiotic use. So in organic farming in the UK, or in farming, in pig farming in countries like Norway or Sweden, you have to wean later, and this leads to much better gut health, far less need for antibiotics. The breeds of animals that are used are also very important. Using resilient breeds of animals, for example, in the Netherlands, over 50% of chickens raised from meat are now of a slower growing, healthier breed. And even though they are still kept indoors, the switch to these healthier animals has lowered their need for antibiotics by over 80%. So diets also have a big impact. If there's too much protein and not enough fiber in the diets, this is poor for gut health. And again, this is often controlled with antibiotics. When Sweden wanted to reduce its antibiotic use in pigs, it adjusted the diets, and this helped it reduce antibiotic use. And finally, banning the routine tail docking of piglets is particularly important. So tail docking is carried out in order to minimize tail biting, which is an abnormal behavior of pigs, which occurs when they are kept in barren and stressful environments. So in countries like Norway, Sweden, Finland, routine tail docking, well, tail docking is generally speaking, is banned except under exceptional circumstances, and as a result, pig farmers in those countries have to improve their husbandry, because otherwise they would have a major tail biting problem. And as a result of these improvements in husbandry, the antibiotic use is lower. So in conclusion, large reductions in farm antibiotic use are achievable. The UK, for example, has reduced its total farm antibiotic use by 59% since 2014, and it's reduced its use of what are classified by the World Health Organization as the highest priority, critically important in human medicine, antibiotics, by 82% over that same period. The European Union as a whole has reduced its farm antibiotic use by 51% since 2011. However, in my view, far greater reductions in both the UK and the European Union are still achievable by improving animal husbandry and animal health and welfare. And the new rule on not using antibiotics to compensate for poor hygiene or inadequate animal husbandry is not yet being implemented properly in the UK or in most of Europe. And the implementation of this rule is really what we need, and this will help change how we farm animals. Thanks.
I think we're gonna use this one. All right, thank you so much, Colleen. You know, I've been writing about and researching this topic for many years, and you've taught me a lot here today, as I'm sure you have for a lot of us in this room. I found the stat regarding Canada within this broader European context, particularly stark. And with that in mind, we're now going to turn our attention to issues here at home. So I will introduce our next expert speakers. We have Lynn Kavanagh. She is currently the Farming Campaign Manager at World Animal Protection, where she helps to develop and oversee the organization's farming and food systems strategy. In the more than 20 years that she's been working in animal advocacy, she's worked on campaigns advocating for companies to make stronger animal welfare commitments, lobbied the government to adopt policies to better protect farm animals, and promoted more humane and sustainable food system, including stronger regulations addressing the overuse of antibiotics in agriculture. And she'll be joined by Leanne McConaughey. Leanne formerly worked with the Vancouver Humane Society as their Director of Farm Animal Programs, where she primarily led their Chicken Out campaign to end the use of battery cages in egg-laying hens. For egg-laying hens, now an independent consultant, Leanne works with animal advocacy organizations, agriculture organizations, and food companies on a variety of farm animal welfare programs and issues. She has since been assisting World Animal Protection Canada since 2022 with their AMR research and campaign initiatives, and serves as their rep on the National Farm Animal Care Council's Board and Executive Committee. Welcome, Lynn and Leanne.
Jessica, thank you, Jessica, and hi everyone. Nice to be here. So here we go. So just a few words about World Animal Protection and who we are. We're a global animal welfare organization. We have offices in 14 countries. And as Jessica said, we're a member of the National Farm Animal Care Council. We're one of 2 animal welfare organizations with membership. The other is Humane Canada. And NFAC, for those who don't know, is a multi-stakeholder body that develops the codes of practice for on-farm animal care. And we work primarily in 2 campaign areas. One is on protection of wildlife, working to end the exploitation of wild animals used in entertainment, the pet trade, and captive environments. And the other is farming, working to end factory farming and transform the food system to one that is more humane and sustainable. So why is an animal welfare organization focusing on antibiotics? Well, you heard through Colin's great presentation that there's a strong connection, a strong link between how animals are treated on farms and the level of antibiotic use. So there's an obvious link there. Taking a one health, one welfare approach, we know that how we treat animals can oftentimes impact human health. And focusing on antibiotics is also a way to call attention to what's wrong with our farming system today. The way we're currently treating animals in the intensive system and the suffering that's involved. Because the poor welfare leads to a need for higher levels of antibiotic use to compensate for those practices. And so by improving the conditions in which we raise animals, we also have benefits for public health. So it's a win-win. Intensive animal agriculture is a driver of antimicrobial use and antimicrobial or antibiotic resistance. The increasing demand for diets high in animal protein is behind this. In the past 50 to 60 years, the increase in the level of consumption of animal foods across the globe has increased exponentially. Canada, for example, consumes twice the global average of meat. And so what has happened as a result is animals' production has become increasingly intensified. Animals have been moved indoors, they're kept in crowded conditions, and the goal is to get the meat product to market as quickly and as cheaply as possible. And as a result, the animals suffer. And this is why they're stressed, they have compromised immune systems, and then hence antibiotics are used as a band-aid approach to prevent disease in these suboptimal conditions. I'm just going to go through the category of antimicrobials, and Colleen touched on these, but just to give you a little bit more detail, these are definitions by Health Canada, which follows the World Health Organization definition of categories of antimicrobials.
So category 1, and some of you may be familiar with this, but essentially those are the antibiotics that are most critical for human health, where they treat the most serious illness, and there's really little or no alternatives to those. The second category are those that are very important for human health. Very few antibiotic alternatives are available to treat the specific illness that they treat, serious illnesses. Category 3 are for less serious infections, and there might be another antibiotic available if one is found resistant to one of these antibiotics. And the low important ones aren't used in human health or human medicine. And so in Canada, just to give you a snapshot of the use, there are efforts to reduce use for sure, but there's still a problem, as Lee pointed out in his slide, and I'll share a little bit more about that as well. But in some of the commodity groups, beef, poultry, and small ruminants, they've increased, but sales for antibiotics have decreased in dairy, veal, pigs, horses, and aquaculture. But to say, it's still important to note that despite those recent reductions, Canada still ranks very high internationally. And in 2022, data shows that Canada ranked the 4th highest compared to 31 European countries, and was approximately 3 times higher than the European median. So still ways to go. This is a graph that shows antibiotic use in farming by the different categories. So the ones I just mentioned, the most critical, the very important, and the sort of medium importance categories 1, 2, and 3. And in farming in Canada, the most use comes from categories 2 and 3, and less so from category 1, which is a good thing. It looks like from this graph that they're not used at all, but they still are. It's just not compared to the other ones. And so a little bit more data here. And don't worry about all the complicated antibiotic names. I could rhyme them off without looking at the graph myself. But just to say that, I just wanted to note that the ones on the purple at the end there, that's a category 2 antibiotic, and 2 of the ones on this graph, the light blue, it's hard to see, and the orange one here, I mean, these are category 1. There's 2 on there that are category 1 antibiotics. Most of them are category 2. So, the highly important and the most critical are still being used in farming regularly. And this is 2024 data. And so what are the costs to antibiotic resistance in Canada? Colleen talked about the global costs, the millions of lives that are lost based on World Health Organization data, and where it's projected to go to and increase if we don't get a handle on this problem. In Canada, right now, antibiotic resistance is at about 26% and projected to go to 40% by 2050 if we don't, again, get a handle and have better action to address this issue. And it's estimated that 400,000 lives would be lost in Canada, that the hospital cost alone will be $120 billion, and that in GDP, the GDP cost will be $388 billion from antibiotic resistance. Again, you heard from Colleen about the how antibiotic-resistant bacteria make its way from farms to humans in various pathways in the environment, or coming in contact with meat or humans, or wastewater on crops or water in the environment. And so World Animal Protection, and there's studies that show that has happened in Canada as well. Antibiotic-resistant bacteria has been found in wells and on crops. World Animal Protection undertook a small study in 2020 in 4 countries, taking samples from industrial hog operations in Spain, Thailand, the US, and Canada. And the samples in Canada were actually taken here in Manitoba, outside rivers and waterways outside 8 industrial hog operations. And what we found was that so it was 42 water and soil samples overall, and we tested for 27 targeted antibiotic-resistant genes, which are the building blocks of antibiotic-resistant bacteria. And we found out of 42 samples, 32 were positive for at least one tetracycline-resistant gene included in the analysis, And more than 3/4 were positive for at least 3 or more tetracycline resistant genes. And some of the positive results, and I don't list the antibiotics here, but were resistant for those antibiotics that are categorized as highly important, that's category 2, or critically important, category 1. And what we did more recently is in 2023, we undertook a comprehensive literature review looking at hundreds of published studies, so peer-reviewed studies of scientific papers across the 4 most commonly farmed animal species: beef cows, dairy, chickens, and pigs. And identified what are those practices that are common to intensive farming that are associated with high levels of antibiotic use. And what we found, and Colleen covered this very nicely, so I don't need to spend too much time on this. Again, and probably doesn't hurt to say it twice because we need to get this message out, right? But premature and abrupt weaning methods. When animals are weaned very abruptly, as the case and sometimes in the beef industry, highly stressful for those animals. So antibiotics are needed because, of course, their immune systems are more vulnerable to infection. Premature weaning, as we heard about from Colleen around in the pig industry. They're fragile newborn piglets, and their immune system is just not resilient. So a large number of antibiotics are used in that case. Unsanitary, crowded conditions, mixing of unfamiliar animals. These cause resistance or illness to spread more quickly through the herd. Hence, antibiotics are needed. And then, of course, breeding, breeds that are less resilient, and body weight gain, and just those are the breeds that are used for high production purposes. Again, they're not resilient, so more vulnerable to infection. And so what we found is that through the literature review is that, just changing the conditions overall, I could go through each one, but you already heard a little bit about that. But just, raising animals in more conditions that are more in tune or in concert with their natural needs and behavior. So, stable social groups, because mixing animals is very stressful for them. Animals like a stable social group. If you think about putting a bunch of unknown cats together in a room, or dogs, they don't always get along, and it's stressful. Straw is a great enrichment material for pigs and can help de-stress. Dairy cows in particular, there's something that's called selective dry cow therapy. So when they have a short period between lactations, they are dried off and they stop lactating. That sometimes happens very abruptly, which can be painful and stressful, but it can also make the animals more vulnerable to infection. If we do that gradually, it's easier on the cow's body. And then the selective dry cow therapy is when antibiotics are given across the herd no matter what. If we do it not selective, just dry cow therapy. When it's selective, you only give them when there's sign of infection. So there's a number of different practices that can be implemented to reduce antibiotic use in farming. And I covered some of this already, so I'll just, and as did Colleen, so I'll just move on. But essentially it's, more space, enriched environments, access to outdoors, not breeding for just production, but giving, animal welfare as a priority indicator or factor in how animals are raised for food in farms. So I'm going to turn it now over to my colleague here, Leanne, to talk about the situation in Canada now as it pertains to rules and regulations, and then I'm going to come back for just a few slides wrap up.
Thanks, Lynn. Yeah, it's there's a lot of concern. We're a little late to the game here with some of the things that we're doing. We have been looking at this for the last 20+ years in terms of public health agency in Canada, but we're behind a lot of other countries, and we could do a lot more. So that's bad news. The good news is that we are doing something, and we have some incredibly talented scientists in this country, veterinarians, animal scientists, and public health, infectious disease people, and they are looking at it. So what I want to do is just talk a little bit about some of the programs we do have in Canada and highlight the pros and the cons and where there are some opportunities for progress. So on the first slide here, I'll talk about these first two a little bit more in a bit, but basically the Public Health Agency of Canada, they started a program called the Canadian Integrated Program for AMR Surveillance, SIPRS. And that analyzes antimicrobial use and antimicrobial resistance, bacteria-specific data from people, animal, and food sources. So it's very much that One Health approach, looking at all the vectors. And out of that, one of the things that was born was CARS, the Canadian Antimicrobial Resistance Surveillance System. And that is basically taking that information and providing reports. I'll talk more about those two in a second. But as a result of all this research and surveillance that was being done, we did get to a place where Canada Health Agency came out with some guidelines where not only did they exclude growth promotion claims from the labels of antimicrobials, but they ensured that to get in-feed antimicrobials or any prescriptions at all, or any drugs at all, you needed a veterinary prescription. And that wasn't the case before. You could just go to the feed mill store or farm store, buy your product as the farmer and just give it indiscriminately in a preventative method. So that was one of the first things that came out in 2018. So that was a very good move to at least put some professional oversight in place. Following that, Quebec actually came out with their own regulations where they forbid the use of category 1, so it's very high important medicines to humans. They forbid the use of that antibiotics in animals, in farm animals. And we had some commitments by the industries themselves as well. Broiler chicken industry and turkeys. In 2014, there was an awareness that they had fairly high resistance to a number of different bacteria, and the antibiotics weren't working there. We had, I think of Salmonella, E. coli, and Campylobacter. So you probably recognize those. Those are very much the foodborne illnesses we hear about in humans. And so they did decide on their own to end the use of those category 1 in their feed. And they then in 2018, they also banned the use of category 2. So this was an industry-led initiative. There were plans to ban category 3, but that has since been suspended. So I don't know what's happening with that one. And yeah, a lot of other industries too are really trying hard to avoid this category 1, but it isn't a regulation yet, it isn't enforced, but it is coming down, and we see that from some of those CARS reports where it's telling us where they're decreasing, as Lynn pointed out. And then sort of overarching all of this, in the background, the Public Health Agency has been putting this pan-Canadian action framework in place to try and look at all the things that we need to do. And it began as a framework of potential plans and programs, and it just released in 2023 with the actual action plan, and it has 5 key pillars, which I'll talk about in a little bit. So I mentioned I was going to go back to SIPRS. So one of the things that does is it collects data at an aggregate level from what we call sentinel veterinarians and farms. So it's not looking at the data from all farms across the country. It's looking at select farms that have been volunteered for this. It goes through chicken, turkey, and pigs lots, and now dairy, which started in 2022. But it only captures certain stages. Typically, it's fairly close to slaughter time because they're looking at it more at a food safety point. We don't include nurseries or weaning facilities for pigs and piglets, sows and piglets at all, which is where, as Lynn mentioned, there's a lot of antimicrobial use at that stage. So that's a bit of a gap. And then further from that, because that was just getting some of the volunteer data, we had this other system called the Veterinary Antimicrobial Sales Reporting. And that was looking at volumes of drugs being sold by compounders, manufacturers, and importers. So again, it was sort of an estimate sales by species, and it didn't include veterinary prescriptions at all. And it was on just the important antimicrobials. That then led to the Canadian Veterinary Medical Association taking the initiative to fill that missing gap that wasn't coming through the compounder sales and manufacturer sales, and look at veterinary prescribed and dispensing data. So that was, it's somewhat anonymous in that there's not details on where farms are, et cetera, but it was at least trying to fill that gap. But one of the really neat things that kind of came out from that, so sort of this progression as we learn more and get into this more, was to come up with this first line app. And that was funded by the University of Calgary and the federal government and CPMA. And it's basically an app on the phone or on a website where veterinarians can go to get real-time access to data on antimicrobial use guidelines, when to use them, how to use them, for how long, which ones to avoid. So I'm hoping that that actually provides some really great data collection at some point that can be publicly shared and transparent. So back to this Pan-Canadian Action Plan. So there's 5 pillars to it. They started with surveillance and stewardship. So stewardship meaning educational awareness. You might remember some of those two bugs and drugs campaigns. And infection prevention and control. The last 2 being research and innovation. So looking at new drugs and new vaccines. And leadership, trying to get all of this coordinated. And I think in the human health sector, there's been a lot of great movement, certainly in 4 of them. Leadership is still, a lot of infectious disease experts will tell you there's a missing piece there, and I'll talk about that again in a second. But on the animal health side, I mean, well, actually, let's just go back to this for a sec. The progress, we do have more reporting, we do have more data. We can look at what's happening and make some policy decisions based on informed content. We are looking at trying to access more drugs, but there's a lot of red tape involved and a lot of delays, and our bureaucratic system on that is causing some issue. And then the fact that we just included the food animals as part of this One Health approach is a really important step to look at this whole holistic level of how everything impacts everything else. And wanted to talk too about this program called FAST, and it's such a great website, and it sort of stopped being updated about a few years ago. I'm hoping and I'm hearing that it's coming back, but for farmers, it's actually an excellent source of videos and podcasts just on all these management practices that Lynn and Cody both talked about, providing how preconditioning of beef cattle before they go to feedlot makes them healthier and you don't have to give them as many antimicrobials. The weaning, the diets, all those things that we know are important to reduce reliance on antimicrobials. And so it's a great source, and I hope that they do something more with it, and also have other provinces do similar work for their own groups. So the gap areas, we still need more data. We need it more granular. We need more integration with different systems to get a better picture of what's happening. You know, a lot of this stuff, it's not mandatory too in terms of the reporting systems, and that's an area where we need to improve. It's a bit fragmented. We have this incomplete picture because we don't have all stages of production. We don't have all farms. We don't have every province included. So there is some gaps. And as I said, like the grower finishing barns are the only ones being looked at, not the breeding facilities in terms of relevance for you know, locally here. And infection prevention and control. One of the things I think for us that we really feel is an omission is when it comes to the animal husbandry section, it really doesn't elaborate much. Colleen talked about the European Union at least saying they can't compensate for poor animal management practices, etc. And ours has very vague wording. I'm just going to grab it here for a second. But I think it just says prioritize sound prioritize sound animal husbandry. That's all it says. They are guidelines in the Canadian Action Plan, so it's pretty loose. It would be very helpful if they could expand on that and say what they mean. That is in the science. Our report does show what works. So it just needs to be spelled out a little clearer. And leadership, recently heard a lot of the infectious disease experts talk about the fact that we have, you know, multiple agencies with all these experts doing great work, but there's no one deciding group that can make a decision for everybody. And even the Auditor General did an assessment of this Pan-Canadian Action Plan. So the 2023 Auditor General report said PCAP, so this acronym, lacks concrete deliverables, timelines, and details about who is accountable for each action. So another gap. So they have to work on it. And first and foremost, we don't have any regulatory bans like Quebec has done, for example, on Category 1 antimicrobials. We do need some better collaboration between vets and producers for sure. and animal scientists and bringing that data to the farm. And a low awareness generally of that link between what practices cause what problems. So that's another area that definitely could be built up on. So what are we doing? As Lynn mentioned, we did our science literature review. Hopefully that provides some input to any policies and programs that are put in place. Lynn's been having some meetings with MPs about the different issues. And we launched just about 2 weeks ago this sign-on letter. And what we're really hoping, if there's any vets or doctors or people in the room that have an interest in this, if you go to speak to us afterwards, we'll give you the website. It's not going to be a letter from World Animal Protection. It will be from the experts and asking policymakers to consider some of these changes and recommendations that we're putting forth. I'm going to send that to the Ministers of Agriculture, the Minister of Health, and CFIA. The House of Commons Science and Research Committee recently held 8 different hearings with pharmacists, veterinarians, and infectious disease specialists about where the problems are, what needs to be done. So the MPs are listening, and it's their task to come up with some plans for what Canada is going to do. So you could too talk to your MPs and MLAs if you have some ideas. And yeah, we just want to see some more direct ties. And Lynn mentioned the National Farm Animal Care Codes of Practice. This is the codes that look at standards for care on farms. They're not enforced, they're not legislated or regulated, but they are voluntary, and farms do, most do know what they are. We'd love to see some of this antimicrobial data put into those codes to make the farmers more aware of how the two are linked. And with that, I'm going to pass it back to Lynn.
Just a few more. Yeah, thanks. Thanks, Leanne. So yeah, some of the policies that we need, and Leanne touched on these, is that the mandatory monitoring surveillance of antibiotic use on farms. That's a first step, the thing that the government could implement. Eventual phase out and ban of prophylactic antibiotic use in farm animals, as they've done in the European Union. Now, Colleen mentioned that there's some issues about, it being followed and enforced, but it was only just implemented in 2022. So hopefully over time that will be the case. And certainly having the regulations in place will start to initiate change, right? So we need to see that. Provide financial support to incentivize farmers to move to higher welfare, more sustainable farming practices. These changes do cost money, and farmers will, right, because sometimes their margins are low, and they need financial support from government. And then also promoting decreased consumption of animal source foods in favor of more plant-based foods. This is really important to relieve that pressure on the intensive farming system that is behind the issues that we're talking about today. Private sector has a role too. So there are a lot of retailers and restaurants that are members of NFAC, the National Farm Animal Care Council. And, they can influence the supply chain and the policies. And so it'd be great if they pushed for antibiotic use and better practices that support a reduction of antibiotic use in the codes. More importantly, they can even have their own policies on animal welfare standards that allow a reduction in antibiotic use in farming. And as Colleen mentioned, in the UK, there has been a lot of progress in this area. And so that's another opportunity. Retailers can take steps to educate consumers. They can be the educator. They don't just need to respond to demand. They can put out material that tells consumers about different products and what they're doing about it. And then work with suppliers to develop better management practices to allow for reduction in use. And so, pointing to the retailers in the UK that have already have the policies are so much stronger than the retailers here in Canada. And I think we're tight on time here. So just to say that they really work very closely, and they have some policies that really help to direct producers and require certain standards for them to sell their product. And lastly, this is an important one. I wanted to say something about antibiotic free, quote unquote. You'll see meat products in the grocery store free from antibiotics. And it's really a niche product for consumers that are worried about having any, chemicals or byproducts or drugs in their food. But what it is a niche product. And we're not, the important thing around policy and antibiotic use in farming is that it's not about no antibiotic use, it's about responsible antibiotic use. Antibiotics have a role in farming. If the animals are sick, they need to be treated. That is an important welfare issue. And so if we just have a niche market, no antibiotics, that is a disincentive to farmers to treat animals because they will lose the premium that they get on that product. Instead, retailers and such need to work with farmers to say, you know, we don't want prophylactic preventative use, we want better farming systems, but if animals are sick, you treat them. And they can also, that's an education piece that they can convey to consumers as well. And I'm gonna leave it there. Thank you so much.
All right, thank you so much for that. It's really important for those of us in this room to get this more regional and national perspective on this issue. For the sake of time, we're going to cut some of the questions that we had planned. I have one question for each of you, so please do stick around for this last bit of discussion. So we're going to start with you, Colleen. The industry will often say that providing preventative antibiotics keeps animals from getting sick, right? That's what we often will hear. So if we're not doing that, then how do we keep animals healthy and how does that impact food safety?
Yes, you're right.
I think it was on.
Yes, so the industry will sometimes say that will this lead to more food poisoning and these sorts of things. And the reality is that if animals are kept in healthier conditions, they simply don't need the antibiotics. But if you allow them to use antibiotics routinely for preventative purpose, then they will. There is a pressure then, an economic pressure to keep more animals in worse conditions because you can always give them preventative antibiotic use. And this can actually have an impact not just on the levels of antibiotic resistance, but there are also bacteria, good bacteria that animals have in their guts, which end up being killed off by the antibiotic, and some pathogens are then can spread. So, for instance, salmonella is known to increase in incidence when certain antibiotics are used. So the reality is that overuse of antibiotics can actually lead to a food safety issue rather than necessarily reducing it.
Okay, thank you for that. So there are also proponents of utilizing vaccinations, Colleen, I'm gonna go to you one more time, to cut antibiotic use. Is this a solution, the use of vaccines?
Well, vaccines can certainly be used and can help control certain infections, and there are examples where vaccination has helped reduce antibiotic use in aquaculture in certain countries. That has helped reduce antibiotic use. But there's also evidence that the use of vaccines, there's in particular in Denmark, where they have data collected on all medication use on every single farm in the country. So they are analysing every single farm in the country. And what scientists have found is that various vaccines that are widely used in pig farming are actually associated with higher antibiotic use. So the vaccines are helping control those diseases, but for whatever reason, the farms that are using the most vaccines are also tending to use more antibiotics. So overall, it does not seem to be a solution. The reason that antibiotics have been so widely used is because many antibiotics help control lots of different diseases, whereas vaccines only help control specific diseases. So many farmers are going to, if they're allowed to use antibiotics preventively, even if they are vaccinated against certain infections, they're still going to want to use antibiotics because it will help protect against anything that might happen.
So, Leanne, I'm gonna ask you this question. What are we asking for here in Canada? What is it that we want to have happen in this issue?
Yeah, so.
Can you guys hear that? No? Yes. I hear both. Yes, sure, there you go. That's a good idea.
Yeah, so three things really. We're asking, number one, to put in at least a prohibition on the category 1 use in farm animals. And also the phase out of the group prophylactic treatment eventually for all all antimicrobials. We're also asking for, at the same time, and this is really important, we don't want them to just withdraw those antibiotics and then leave the animals in these systems where they're more susceptible to disease. We want to see that those changes are commensurate with the withdrawal of the antibiotics, so that we don't have a lot of sickness happening. So that's very key. And then the third thing is to see that kind of tracking, like Colleen mentioned with Denmark, where they're tracking all the use, all the farms, and provide that information, those very user-friendly reports, very transparent for the public to understand.
So we're not talking about completely antibiotic-free farming here, is that right?
That's correct.
Right. Lynn, did you have any thoughts on that idea that we're not actually talking fully antibiotic-free farming?
No, is that on?
Yeah.
No, we're not, and like I said, at the last slide I presented, it's really, there we go. It's really about responsible use and appropriate use, and we want to make sure animals are treated if they're ill, if that's a welfare concern.
Okay, so finally, I'm gonna leave it on with you, Lynn. What can everyone here do? We are here, obviously, this is a group of people who have an interest and concern with this issue. What is it that the people in this room, the people at home, and those who are concerned about this issue, what can we all do to help?
Yeah, thanks for that question, Jessica. I think, number one, educate yourself. Being here is a great start, right? Getting familiar with the issue, it's a complex one, but we all have a role to play in making changes, like positive changes to the food system, and how animals are treated on farms. We can buy, we advocate eating less meat but better meat. If you are going to eat any animal products, then buy organic, look for the labels who are certified humane animals that have access to outdoors, that kind of thing. It's not just about no antibiotics, it's about how the animals are treated as well. Talk to your MP, your MLA, talk to your grocery store manager, because they work directly with the producers. So there are different kinds of actions that you can take. Write a letter to the editor on this topic. If there's an article in the paper, write a response to state your opinion, and because that's a lot of people read the letters. And that's a nice piece of opportunity to educate as well.
And tofu doesn't get sick.
Yes.
So it's a great place to end the evening. Thank you all for this incredible panel. Coylin, Lynn, Leanne, please join me in thanking them for being here with us today. Of course. This isn't the end of this discussion. This is just the beginning. The Winnipeg Humane Society will be hosting more information sessions around antibiotic resistance, factory farming, and your health in the coming months. So stay tuned to their social media and website for more details. Thank you again for joining us, and let's keep talking about this. Have a good evening.